Dr. Eric here with another tip of the week. We're talking about low back pain. 80% of the population suffer from low back pain at some point in your life, and unfortunately I was a victim of that. Last week I had severe low back pain, and it was pretty debilitating. So just wanted to talk a little bit about what I went through today, and then also just some strategies for your own to consider low back. So the low back is the crossroads of the body. So when you're considering looking at the lower back, you should also take into consideration looking at the hips and the thoracic spine, which are players that influence the lower back. Now, the lower back only has about 5 degrees of rotation. So if we're lacking rotation in the hips and we're lacking rotation in the upper part of the back, then the low back can sometimes suffer. So in my case, where I suffered some low back pain, my symptoms were kind of right here on the right lower side, which is pretty common, unilateral back pain. So it was definitely important that I treated the area of symptoms, but where the symptoms were actually started from were in my hip. And I've always noticed that my right hip in the front has always been a little bit tighter and more gunky. So that just predisposes me to possible injury of my back, and unfortunately last week that's what happened to me. So when you're looking at the lower back directly to make this area feel better, you can consider a mobilization tool. Now initially, because my pain was so tender and severe, I had to have another physical therapist, my lovely wife, Tammy. She had to introduce her hands into my back to actually create some more mobility in my tissues. Now once I started to feel better, I could increase the tissue mobilization to like a tennis ball and then into a lacrosse ball. So remember that you don't always want to just jump into a heavy lacrosse ball at first if your symptoms are extremely severe and irritable, where that actually can make you worse. So once again, after she kind of introduced her hands into my back and made it feel better, I could then progress myself to a lacrosse ball. So I can use a ball on the lower back. You definitely want to be on the more medial part of your spine, not right on the vertebrae. So you can put the ball on your lower back and then mobilize the tissue underneath by pulling your knee to your chest. And that'll kind of get into that thoracolumbar fascia to help break up some of the connective tissue and give you some more mobility. Now, like I said, this cause of my pain was from my hip. The anterior hip complex was kind of driving some of this issue in my spine. So I also had to make sure to really address the front of my hip. So a couple strategies that I went through that was helpful was I did a kind of a kneeling stretch to help kind of put my femur into the ground to isolate that hip flexor. And then I was able to kind of work through some of that hip tightness. Also, I had to do some tissue mobilization, some dry needling in my hip to help free that up to allow me to have some less low back pain. So when you're considering low back, my main advice to you is to treat the area of symptoms, but also make sure that you're looking at players above and below. Without normal mobility and stability in those spots, you can really suffer from low back pain. So use some of those words of wisdom that I gave you. Try some of those stretches in previous videos that I've posted, using a mobility bar or mobility ball to your spine. And definitely let me know if you have any comments or suggestions. Like it, share it, and check out my YouTube channel. Thank you.